Welcome back. Look, in recent weeks, a lot of people who are living with heart disease, high blood pressure, diabetes have postponed those non-emergency surgeries and in some cases doctor's appointments. But as hospitals ease restrictions, doctors are saying do not delay medical care. Doing so is literally killing people. And joining me is Dr. Mariell Jessup, the American Heart Association's top medical officer. And Dr. Jessup, I'm sorry if that sounds, sort of harsh to say it that way, but we saw the numbers from MedStar in our last hour and they are trending in the wrong direction. So at this time, is it safe for people who are living with heart disease to go see their doctor or schedule a non-emergency procedure?
Absolutely. Doctors and hospitals have had 2 months to plan for the return of patients in a safe manner. They've reorganized their offices, reorganized the hospital, and it's really time for patients to call their physicians, call their healthcare team and say, when should I come in? Of course, everyone has to wear a mask and wash and not touch their hands, all of those things, but it's time to go back.
Now, let's break it down some more, because people might be sitting at home and saying, well, what is an example of a non-emergency heart procedure? So what would you say?
For instance, people may have a narrowed valve, aortic stenosis, and it didn't require emergency replacement, but it may be time to do that now. Or they may have a hole in their heart, or they may need a defibrillator implanted to prevent sudden death. All of these procedures probably have been postponed and safely postponed, but it's time to get back on the schedule.
Now, let's say these patients choose to go into a hospital for a procedure. What steps could they take to reduce their risk of exposure to COVID-19? Because as we know, they're in that high-risk category.
Exactly. I think they should call first and find out what the procedure is. Many offices and hospitals will actually ask you to sit in your car and they'll text you when it's safe to come in. Do all the things we've been doing for the last 2 months. Wear a mask, wash your hands frequently, don't touch your face. Keep social distancing from other people. And just don't be afraid to ask, what's the procedure? How should I go in?
Yeah, asking questions, always the way to go. And Dr. Jessup, I received a tweet from a viewer in the last hour who said, look, I've lost my job. I don't have health insurance. I would love to, get my medication, but I just don't have the means for it right now. Can you explain what the American Heart Association is doing to help people who might find themselves in that situation?
We're here to help. We have a number, 1-800-AHA-USA-1. You can call. There are all kinds of resources for people who have lost their insurance and lost their medications. Many companies are paying for medications for patients who are in this situation. So again, don't be afraid to ask. Go to the pharmacy and ask, call your doctor and ask, and come to our website for other recommendations.
Dr. Jessup, thank you so much for your time. It is, of course, important to know the warning signs of both heart attack and stroke. I've posted those to my Twitter, Facebook, and Instagram stories, okay? So the information comes directly from the American Heart Association, and please check it out and share it. It's so important.
She's one of the top docs, you were telling me, so you've heard it from her.
Yes, she is a big deal.
Okay.